black hair, white, interviewing one of our staff who's going to be entering our Uno tournament. And she has promised to win and share her cash prize with me. Isn't that correct? Yes, you're on TV, so now you have to give me the money. Good morning, Virgin Islands. We're having our open house today, this World Mental Health Day, and we're encouraging the public to come out and meet with all our agencies that are here today to get some information and have some fun with us.
Happy World Mental Health Day 2025. Our mental health theme for this year Our mental health team for this year is access to services, mental health in catastrophes and emergencies. Welcome, welcome. Come down to Dr. D. Orlando Smith's Hospital. In the lobby, we have our open house today where you'll find different vendors and organizations that provide different services. You can find information. We have the BVI Diabetes Association. So you can come on down and get your blood pressure checked, get some information about healthy eating. You can also have your blood sugar test free, of course. All of it is free. And we have lemonade, BVI in the house.
So we're here with the BVI Diabetes Association, and they're doing blood glucose monitoring as well as blood pressure monitoring. So you can come over to the D. Orlando Smith Hospital and get a free screen. And they also have a lot of wonderful information here to help us understand what constitutes a healthy meal, what constitutes an appropriate serving. So come on over and engage with our lovely volunteers from the BVI Diabetes Association.
All right, so good morning once again, and we are here at the World Mental Health Day. I am with Miss Huggins from the Diabetes Association. How are you doing, ma'am?
I'm doing very well. Thank you for asking.
And can you tell us a little bit of your organization and what we're doing right now?
Okay, the Diabetes Association is an educational resource where we provide information not only to clients who are deemed to be diabetic, but for the general public, come in to get some information about how to manage and control their health in terms of not being diagnosed as a diabetic person. On Earth, well, this is our director, Rosie. I'm just an office assistant. But we try to do quite a few things. We sell diabetic products. We also check glucose level, your blood sugar and cholesterol level as well. In our management, we try to make people aware of the food that they should be eating and the portion. Because it's not really all that you eat, but it's how you eat, what you eat, and how much you eat. We also try to encourage people to exercise and take their medication as well.
Well, thank you very much, Miss Huggins, and I'm gonna go here with Miss Rosie and interrupt her for the meantime. She's currently checking the blood sugar of one of our staff, security staff here at the hospital. My apologies for interrupting, Miss Rosie. But my question to you is, the mental health team this year is about helping with crisis and catastrophes. With the Diabetes Association, based on experience with Irma, with COVID, how do you think the Diabetes Association will be able to help in terms of next, hopefully not, but if there's a next catastrophe or crisis coming in?
Thank you for having us. The Diabetes Association played a big part in the past with the COVID as well as the hurricanes. What we did though, we had supplies, which we usually provide supplies at cost in addition to our free screenings. We also were able to assist our clients with free medication, free screening supplies and advice. We were for the hurricane, we also received supplies from other Caribbean countries like Diabetes Association of the Caribbean, the American Diabetes Association. They too assisted us here with medication as well as supplies, which we gave out free to our clients from the Diabetes Association from that end. So we were pretty well okay in that area. So we don't have a problem in assisting when, or we hope not that we have a disaster in such again, but we don't have a problem in assisting in that area.
Thank you very much, ma'am. You know, in times of crisis and catastrophes, it is very important that we mobilize all our resources in the community so that people will benefit not only from mental health but also from medical concerns. Now, Ms. Rosie, how will they be able to contact the Diabetes Association if they would be needing anything, any assistance? How can we reach you? Like, where is your office? Or like, give us the details of how they will be able to reach you.
The BVI Diabetes Association is located in Main Street, the Dr. Jana Downing Resource Center. Our phone numbers are 494 4125 or 442 4125. We are open on a daily basis from 9 to 4:30. You can pop in at any time. We are on Facebook as well. You can look us up on Facebook. That's
And
it.
do you have any like since we're live streaming, do you have any projects that are up and coming? I know the Diabetes Association is very active in the community. They do a lot of like the quiz bees, like if you have any up and coming event, you can advertise it here right now.
Oh, thank you so very much. Yes, we have quite a few events coming up. At present, we do have quite a few invitations this month, which is October, to attend health fairs and other events. But for our November events, we do have a full calendar, which starts from the 1st of November. We're going to open November as Diabetes Awareness Month. We're hoping to do an opening at Government House with the Minister of Health as well. And then we will have a church service where we are going to recognize one of our founding members, Nostatika Scatliff. On the Sunday, which is the 2nd, we open with a church service at the Caribbean Methodist Church. And we move down the line where we're going to be having screenings at Right Way and the sale of t-shirts, and we would move on down to World Diabetes Day where we do November 14th. We do the Human Circle while we join our international members, where we do the Human Circle and we get those pictures back to international. We also will be at the seniors in West End, where we have a health fair with them at the West End Community Center. That's on the 12th. We have the Elton George's Run Walk, which is on the 15th, and we're inviting all business, corporate, or whoever, just sign on with us. And you can use your branding or use something blue. We are not selling any t-shirts for the walk this year, but what we just inviting you to sell your brand. And registration is only $25 per person, which includes we have events such as exercise, we have music, we have a breakfast afterwards, and we have health talks. So join us on November 15 for the Elton George's Run Walk. You can call to sign up for the walk, 494-4125, 442-4125. And we are located in Main Street next to Roger Downing and Partner. We also have our big gala at Government House, which will be on the 7th. And also, it's $75. We also call in our members to come out. Your prices will be a little bit better, so we are encouraging everyone to come out, support members, come out and get your tickets for the event at Government House. What else? We have the Blue Friday, which we also have Sneaker Friday and Blue Friday. That's on the last Friday of the month. So we have quite a few events which we will post on our page. You're going to hear in a lot more of our events on via radio and all social media. So we're going to put out all our events from next week. So we're looking forward to having the community join us as we try in our endeavor to educate on healthy lifestyle changes. I thank you guys again for having us.
Just before we go, you asked about some of the services that we do, and we have Nurse Samuels, who is specialized in foot care. So she will tell you more about what she does.
Hi, I'm Nurse Samuels, Mercedes Samuels. I'm a foot health practitioner at the Diabetes Association. We concentrate on checking the circulation and the sensations of your feet. We do nail cutting. If you have corns, calluses, we also deal with that, and ingrown toenails to an extent, not surgically. So those are some of the things that we do as foot care.
So, thank you very much, Nurse Samuels. Thank you, Madam, Miss Rosie. Thank you for always supporting the community mental health and substance abuse. I always see that you have a table every time we do have some events like this. And we must not forget that there is a direct link with diabetes and depression. So there are several studies that have said and reported that people with diabetes, they have a 50% chance of having depression. So as you see us working together, if you see people in the diabetes organization, they will give you more information about that, and help them and then be a member of the organization. Thank you very much once again. All right, so moving on, we are here in the table of social development, and I'm with Ms. Tisha Foy and Janelle Victor. So they will give you a little bit of information about their department and what they have here for us today.
Good morning. We're happy to be here from Social Development Department. As you guys know, social development is the umbrella for vulnerable persons where they can come and seek services where they can be able to meet their basic needs. I'll speak today, I'll touch a little bit on elder care as well as disability services. So in the event of, say, a family member is seeing loved one reacting differently or out of the norm, they would usually come to us for whether it's home care services or grant for assistance. And so we complete our assessment, our initial assessment, and if we see it might be a case of dementia or Alzheimer's, we usually will make the referral to BVI Health Services, to the behavioral ward, or to other outside agencies, whether it's for counseling or therapeutic services. After those services are completed, if there's a need for support in the home, then we will provide home care service where a geriatric aide would go in and provide the care so persons can live in the comfort of their homes, remain in the comfort of their homes just with supervision. There's also the disability services where persons who have different disabilities, whether it's autism or just, old adults who are not elderly, but they're unable to care for themselves, they can attend BVI services where they engage in regular activities, arts and craft, they do outreach programs. We also, for the seniors, we also have the senior engagement programs where persons who remain at home, if they're becoming depressed, they're lonely, they seek, they want to be with their peers, they can attend the senior engagement program, which we have 2 in operation right now. One is located at the East End Community Center. They meet on Tuesdays and Thursdays from 9 to 3 o'clock. They can receive a meal, snacks, they do field trips, they also engage with other seniors within the community, and it's fun, they love it. And we also have our next center that operates in West End on Mondays and Wednesdays, and it's the same time from 9 to about 3 p.m. So those are some of the services that we have, for persons who may be feeling down or experiencing some form of mental, depression or whatever it is. And it's not just for persons in that category, but anyone who would like to attend, they're free to attend. The service is free. Transportation is provided, and yeah, I think I touched a bit on elder care and disability services. And I'll pass the mic to Ms. Tisha Ford.
Hi, good morning, everyone. So we also have services like public assistance programs, where persons can come to the department and fill out the application form, where we also have a checklist in the back with all of the required documents you will need in order for your application to go forward to the committee. We also have children and family support services. We also have children and family support services where our social workers goes out to the schools, to homes, just to make sure that children are in a safe environment and they have all of the adequate resources that they would need to strive in our community.
Thank you very much, ladies. I just have one more question. So again, the theme of the World Mental Health celebration is about crisis and catastrophes. With social development, tell us your, like how does the department help in those times, and like with your experience with the department during like the COVID and the past hurricanes, tell us how people can reach you during those times or after those events.
Okay. In crises like the hurricanes that you spoke about, like we do have the community centers, shelters for persons who would have been without homes at the time. And there are many locations for those community centers. So we work in tandem with DDM to provide shelters during those crises. There's also, like she mentioned, the social assistance program where persons can seek financial assistance if they're not working. During COVID, a lot of persons wasn't working. They were able to access services, financial service, food grants, assistance to pay rent, shock response. So those are some of the ways in which the department assists with those crises. We can be contacted at 468-3636. We have 2 locations here on Tortola, one adjacent to Happy Lion in Lower Estate, and the other is next to Red Cross, the building right next to Red Cross. We also have an office over in Virgin Gorda that's located in their big government complex. Did I miss anything?
Thank you very much, ladies, and I really appreciate you joining us today, and I really commend your service to the community. A lot of people are benefiting from what social development is doing. I really like the elderly center. I encourage all the seniors to visit the elderly center program because that is going to be a lot of help, especially for people who are retired and, they didn't plan their retirement well and find themselves not doing anything at home. So I really appreciate you joining us this morning, and thank you very much. All right. So this is a very colorful table. All right. So I have here Miss Simone Foster. She is the one responsible for building Lemonade BVI, and she's here with us to share what their organization is about. And good morning, Simone.
Hi. Good morning, Doc. It's really good to be here. Thank you for inviting us along. This is my cousin niece, Tarsisha. She's my very able helper today. And she's learning a bit about lemonade and what we're doing. So it's perfect for her to get a hands-on experience with it. So what lemonade is about, no, it's not a lemonade stand. We don't sell lemonade. We do use it metaphorically to mean we turn challenges into opportunities for growth and development. And so, as they say, when life hands you lemons, you make lemonade. We're a group, community-based, community-forward, of parents, caregivers, doctors like yourself, advocates who support families with neurodivergent children. And so what we are attempting to do is to level the playing field in our community, in the world, hopefully, where persons who think differently or behave differently are also given an opportunity to grow and develop. And so through various programs that thankfully we do have some funding this year. Some of our sponsors include Unite BVI, the McLean Association for Children, CFVI via the Banco Popular Fund, and Guana Fund. We also have Speech Therapy Services of the Virgin Islands is a big supporter of ours. And so it's not only these individuals, obviously we have support that shows up in various ways. And what we do appreciate is that more people are getting on board with this. They're understanding that the children are not just bad, or the parents aren't just not strict or disciplined enough. It's just that we experience the world differently, and we have to give people an opportunity to do so. So we have programs running. What you're seeing on the table here today are items from our family assistance program, which provides sensory support item to students, to school-age students who need additional assistance, whether it's in the classroom or at home. So imagine a child has sound sensitivity. They're easily distracted by someone talking or a car passing outside or just general ambient noise. What we offer is a noise-canceling headphone where that child puts that on and suddenly the world quiets down a bit for them and they're able to focus a bit more. Some children have